The idea of Global Partners was a very cutting-edge idea. As we looked around, no other healthcare system was doing this type of program. The only other examples of global work were really more self-serving, trying to develop clinics that would be generating revenue for a health system, but really doing something that was volunteer-led and philanthropically funded was such a unique idea.
When we started out, one of the important pieces was to say, how do we organize an activity that can use both the strengths of our organization, which is the people, but also understand the strengths of the people we'll be working with and learn from them so that it can improve both groups at the same time.
And so we thought we have the opportunity to really blaze some trails with this, but it was a little intimidating at the same time, not knowing what we didn't know. And so we've learned a whole lot through this experience.
Well, when we first began, Global Partners was, well, a struggle. It was a lot of hard work by a lot of people to not only get the funding, but get organized, make connections. I don't think there was ever a time when I didn't think it would work. I really believed in the concept. I believed we could make it work. I think there are always going to be ups and downs, but I had great faith in the strength of our people and the breadth of assets that we have.
We came in a bit naive, but it was really about starting to develop relationships with our partners and organizations, starting to develop trust, a lot of listening, trying to understand our partners' perspective on what their needs were and how we could add value to their programs.
We knew that this would be much more impactful for the communities, and it would be community-centric. It's less about feeling good about the volunteer experience and doing what's right and best for that community and for future generations.
And we were talking about the medical world, the economic world, housing. Gosh, what else could we do to partner with people? What we were intent on doing is not going in there saying, gosh, here's what you need. It was to say, here we are, here you are. How can we work together for the benefit of our community and your community?
We've seen great development of relationships. One of the main barriers we had to overcome was that of trust. We had to first start by developing one-to-one personal relationships with some of the leaders.
Over time, it's taken many conversations, many meetings. It's taken layers of communication. And that layering of communication really has developed into a trusting relationship that didn't happen right away. It took time.
The growth of Global Partners, I think, is based on several things. First of all, it had a core group of amazing people that were taking on this important work. The fundamental concept of there will be a give and take back and forth helped buoy it up through some tough times and allowed us to engage an ever broader circle of people within the lacrosse community and beyond to be a participant. The fact that we have a very strong leader for a long time, Liz, has been immensely helpful.
As we grew several years into the program, we recognized that the medical and surgical brigade model, although it's great at providing care to patients who may not otherwise have access to those services, really did not invest in the community. It did not build capacity in the community. It didn't leave something behind after we left. And so we wanted to make this shift towards something that would make longer-term impact and improve the health of that community for generations to come. So what we landed on is really investing our time in training for healthcare professionals, providing resources to clinics and hospitals in our partner communities, investing in K-12 education, helping kids succeed in school, early literacy, also just working on scholarships so that we can support students in school and in their pursuit of careers after high school.
I really value our focus on sustainability and relationships because that was our foundation in the very beginning, and we have chosen to continue to focus on that as two of our core values of our program. We focused a lot on sustainability, so working with our partners to figure out how do we measure the outcomes, how do we make sure that we are leaving something behind and that our approach is sustainable and that it's an approach that's supported by our partners as well. So our other core values of stewardship and volunteerism, huge focuses for us. We've seen volunteerism grow year over year. We've seen a huge percentage of our volunteers want to go back on multiple trips, which really helps to build those relationships and the trust with our partners.
Because we accomplished things, because we actually got people there and back in one piece, because we actually made a difference in the lives both of our people and the people we were serving, that is what allowed us to continue forward and to have this wonderful streak of philanthropy that's helped pay for all this work. The generosity comes from outside donors, but it's a generosity of the volunteers that go as well. I mean, they take their vacation time, they spend their own money. That is a great deal of generosity.
I feel very fortunate that I've been able to travel with several of our volunteer teams, and on every trip, I think meeting the community members and seeing our volunteers interacting so genuinely and compassionately with that community is one of the most enriching parts for me. And then seeing the gratitude of the patients. One moment that stands out to me is when I was in Ethiopia with our team, the dental work was so popular. Patients would walk for hours in the mountains in order to come to the clinic for services. And sometimes they would wait all day or even have to wait until the next day to be seen. And at the end, they may have gone through something that was fairly painful, even with medications, and they would want to give a hug to the dentist and just say thank you. And honestly, tears of joy for having received that care. And that sticks with me.
My favorite moments are always seeing kids get glasses, and to see them put on a pair of glasses and to be able to see is just one of the most rewarding things, because then I know we've made it. We've made a difference for those people.
There's always this moment about day 2, day 3, when the reality of what the expectations were for that volunteer are met with what the reality is of whatever that experience is. And I think that's such a transformational time for any volunteer.
I'm quite grateful for the opportunity that Gundersen has provided. I've become more tolerant and more patient because I've been used to working in this westernized medical system where everything runs on time and you have to do things quickly and move from one task to the next. And in that society, that's not the case. I think that's changed me personally and in my profession to let me be a better physician and a better person and better friend, hopefully a better father, better husband, etc.
I've met some people there who are terrific people, terrific doctors, nurses, therapists, educators. They don't want anything more than anybody else. They just want to have enrichment of their lives, better health, better medicine, better communication, better education.
Things have changed dramatically in the decade I've been involved, and I'm sure will continue to do so over time. So I think we have to be open-minded and continue to look for the places where we can be of best service and listen to the people there, and they will kind of direct us and tell us where we need to go.
And I am so excited at what we're doing already locally, and in the next 10 years I hope that work can simply continue. There can be a lot of cross-pollination between the sites where we take things that are working, for example, health fairs and first aid training on Pine Ridge, or providing physical exams, or the health education efforts and cancer prevention efforts, and look at how do we use our resources, how are we innovative and creative to address some of those similar issues in our own region.
One of the important things for people to understand is this program is so broad. Anyone with any talents and any level of resources can become involved. We need volunteers to do lots of different things, both locally, in the United States, and internationally. We need philanthropists and we need people that can put their hands on patients and help them. We need teachers. We need a variety of people to help us serve this mission. So I would encourage you to find out more and get involved because it will enrich your life as well as others.
So as we continue to grow as a program, my hope, my dream, is that this work continues to improve the lives of individuals all around the world, including here in our own region, and in the process, that we as Gundersen employees, that we as community members, we as parents, as educators, really develop an increasing spirit of generosity and compassion that allows us to engage effectively with our diverse neighborhoods, our diverse community, and really to show that spirit of generosity right here at home.